Rhinoplasty is a surgical procedure designed to change the appearance of the nose. When performed by an experienced plastic surgeon with lots of knowledge in rhinoplasty, this can be a very powerful technique, improving the shape and size of the nose and the overall harmony and appearance of the entire face. Depending on the specific needs and desires of a patient, we can make lots of different maneuvers to change the shape and structure of the nose. We can straighten the nose, we can shorten the nose, we can make it more narrow, we can reduce the overall size of the nose, and we can reduce also the dorsal humps that bother lots of people. We can change the size and shape of the ala, and we can even address factors that may be inhibiting perfect breathing for a patient. At Premium Care, we have a very refined approach to rhinoplasty, which allows us to get very consistent, natural, and long-lasting effects for our patients. The nose is a central and dominant feature of the face, and getting a great rhinoplasty plan is critical to success in getting it right the first time. When performing a rhinoplasty, there's 5 key elements that we want to address in every case to get it right. Number 1 is a dorsum. When we finish a rhinoplasty, we want a dorsum that's nice and straight or slightly concave, but we never want to overdo it to give it that unnatural scooped out appearance. Number 2 is the tip. We perform very elegant maneuvers and sutures in the tip in order to give it more definition and a more refined appearance. It's very important to never overdo it though to give someone a pinched and unnatural rhinoplasty type of look. We want to keep things natural. Number 3 are the ala, or the nostril openings. When we finish a rhinoplasty, we want very smooth, symmetric, and natural ala so it blends in harmoniously with the rest of the nose and the face. Number 4 is the bridge of the nose, or the bones. In cases where these are wide, we make very precise and meticulous fractures along the bones in order to move those together to make a more narrow and straight nose. It's critical to do these carefully and precisely so that at the end of the surgery, everything is perfectly straight and symmetric. And number 5 is the tip position, or rotation. Depending on where we start and the goals and desires of the patient, we can set the position and rotation of the tip to be really just where we want it. And getting this right is key to success. If we can do all of these together and plan them well and execute them well, we should get a great result. Recovery from a rhinoplasty is really pretty straightforward. We perform the procedure in a surgical hospital under general anesthesia, and it generally takes 2 to 3 hours. After a few hours in the recovery room, our patients are home. We generally put a splint and dressing, which we take off on day 4 or 5, which is when we remove the sutures. Fly-in patients are here for about a week. There's some swelling that persists for the first couple weeks, but I think at that point most people find that they're ready to be in the public eye. There's continued improvement for the next several months after that, where the results really settle in and we're able to get our final form. We love performing rhinoplasty procedures because of the overall powerful effect it can have on a person's appearance. A really well-planned, executed rhinoplasty can change the overall harmony and balance of a person's face. And we really love seeing our patients and the great addition that a great rhinoplasty can bring to their lives.